January is Thyroid Awareness Month, and with me I have Dr. Alan J. Garber, who is president of the AACE, to interview about thyroid awareness. Dr. Garber, how common are thyroid diseases?
Anywhere from 15 to 30 million Americans have thyroid disease, and at least half of them is undiagnosed. They're totally unaware that they have it.
What are some signs that people might notice that would prompt a further discussion about thyroid disease with their doctor?
Well, their signs and symptoms are subtle. We know that the thyroid is a small gland at the base of the neck, and it makes a critical hormone that controls energy metabolism in every organ of the body. The symptoms are the result of the organs not working properly. So if you're underactive with regard to your thyroid, you may have too little energy, feel sluggish and tired, that your bowels will be sluggish and constipated, you'll have dry skin, you'll be losing hair, and you just will be unable to get through the day without sitting down, perhaps even resting. At the other extreme, if you have too much, you'll have palpitations, nervousness, irritability, sweating, frequent bowel movements. And so what one's looking for is a pattern of symptoms of either under or overactivity.
And so it sounds like they're pretty difficult to diagnose since there's a lot of other similar conditions that might have those symptoms.
You're absolutely right. It overlaps so many illnesses that it requires a skilled practitioner to listen to the patient and then think about thyroid as one possible explanation for the patient's difficulties.
And why is it so important for women, especially mothers, to be aware of whether or not they have thyroid disease?
Well, thyroid disease is more common in women because, as you know, women are more susceptible to autoimmune diseases like arthritis or skin conditions. And thyroid disease, in many circumstances, is also autoimmune and may be seen in conjunction with another autoimmune illness.
And are thyroid diseases typically passed down, or is there a higher likelihood of children having them if parents do?
Certainly, autoimmune diseases tend to have an inheritable increased prevalence or risk of having them, and thyroid is in that group. You're absolutely correct.
Do signs of thyroid conditions typically show up in childhood, or are they ones that typically don't show up until adulthood?
There are some thyroid conditions that show up in childhood and even in newborns, but they're rare. Most commonly, this occurs somewhere in the teenage years or young adult life and increases as you get older, particularly in women.
Okay. And then I heard a little bit about the Same campaign. Can you talk a little bit about that?
Well, recently it's come to the attention of our organization, the American Association of Clinical Endocrinologists, that increasingly pharmacies and mail order benefit plans are substituting thyroid tablets from different manufacturers when you have your prescription renewed. Now that's a concern to us because thyroid hormone tablets are made differently by different manufacturers, and they have different absorption rates of the medicine into the bloodstream. So not every patient gets the same blood level with different pills from different people. You have to basically ensure that you take the same tablet from the same manufacturer with the same markings and the same dose at the same time every day.
So it's not just like taking a couple of Advil for a headache. It's really particular then.
It's a very sensitive to manufacturing technique. Some generics and other manufacturers are basically equivalent. But when it comes to thyroid hormone, if you start with one manufacturer, stay in that manufacturer's product and when you're up or down regulating the dose of the thyroid hormone. Switching between makers is a bad idea.
Just a couple other questions. What are some people, if people don't have thyroid conditions but know somebody that does, what are some things that they can do to help support friends or family members?
Well, there's several things you can do. The first is to educate yourself so you know what's going on, and that's why you should consult our website, for the lay public, thyroidawareness.com. The second is to make sure that these people get the proper medical intervention. The average family physician is more than capable of screening for under or overactive thyroid. But in fact, if there's more problems or this is not being done and the patient's not feeling well, then you need to support that person to see a skilled professional who's perhaps a specialist in the area to get the advice and the recommendations that the patient needs.
All right, thank you very much. And then that website again was thyroidawareness.com?
That's correct.
All right, thank you very much for your time.
You're most welcome.